The TRANSCEND study is by BMS Juno and company, and it has several cohorts. As we all know, the large cell lymphoma cohort part has been published in Lancet Oncology, and the FDA is looking at the data and is pending FDA approval. We hope very soon. At ASH 2020, we are reporting the TRANSCEND mantle cell lymphoma part. As we know, this is also a potential pivotal cohort for mantle cell lymphoma relapsed. In this study population, we have 32 patients so far enrolled and ready for a preliminary data report. And they have a median prior therapy over 3. And so far, the grade 3 or 4 toxicities for CRS and neurotoxicity are very low. And the response rate, overall response rate is 84%, and CR at 66%. And this is indeed a very good set of data balancing the CRS and low rate of CRS and neurotoxicity with a high response rate, and especially the CR rate of 66%. As we know, in the ZUMA-2 clinical trial that I led and published, the overall response rate is 93%, and the CR rate is 67%. So in the Juno clinical trial, and the CR rate is as high as 66% at such a low cost of CRS and neurotoxicity. So this is a very promising therapeutic modality, and we are actively enrolling to finish this cohort so that we could make this therapy available to patients as soon as we could. And also, there are also differences with the prior studies on mantle cell lymphoma, is that the infusion of CD4 and CD8 is at a 1:1 ratio, but a CD4 cell infusion and a CD8 cell infusion is consecutive. In other words, they are infused separately, one after another in all the patients. And also the cells infused is between 50 million, 100 million, and the 150 million for the large cell lymphoma cohort, but for mantle cell lymphoma, the main cohort is 100 million cells. As you can see that there's a dramatic difference between this one and ZUMA-2 studies that infused 2 million cells per kilogram. So 2 instead of 100 million. I would like to remind everybody is the co-stimulation molecule is 4-1BB instead of ZUMA-2 with a CD28. I cannot compare with the 2 clinical trials, but this set of data put each other in the right context.